Next up, we have Shari Egeland, and she is currently the Associate Director and Research Specialist at Omni Youth Program. She's been with Omni for over 15 years, where she trains and teaches professionals, teens, young adults, parents, and families about alcohol, tobacco, and other drug prevention. She has been working with and supporting youth and families in the Sacramento area for the last 30 years. So Shari, you are up, take it away.
There we go. My unmute button wasn't working for a minute. It scared me. I'll go ahead and share my screen here. Okay. Come on. Everybody good? Can see that? We're good? Okay. Yay. Well, so how long do we have, Lindsay? I just wanted to check in on that.
We gave you 15 minutes. We're gonna run a little over for those that want to stick around. I hope they do, because we are recording this.
Okay. Well, brevity is not my strong suit, but I will do my very, very best. Thank you so much for having me today. As Lindsay said, I am Shari Egeland. I'm the Associate Director at Omni Youth Programs. Feel free to write my email down if anybody, I'm happy to share these slides. I'll go ahead and send them to Lindsay after, because there are some links and things that you might find helpful. We are located, our physical office is in Sacramento here. We are one of the 4 prevention providers that are funded through Sac County. So thank you so much for that. Feel free to check out our website. We have a lot of online resources, a lot of quick videos on our YouTube channel that you can get. We have a really good blog that's written firsthand account by some of our younger staff. We were just talking about the importance of the of the perspective of the younger generation. And there's some really good resources on there. So feel free to check that out. Before I start talking, they did ask me today to talk about some of the signs that parents and other adults can look for in young people that might be thinking about using drugs or starting to use drugs or are using drugs regularly. So I wanted to make sure before I start and say, you know, a lot of these signs are just make kind of a general, so it can be kind of difficult as a parent because you want specifics, but the important thing, whether you're a parent, a caregiver, and a parent doesn't have to be a biological parent by any means. It can be somebody that cares for that youth, that has that role model kind of relationship with that young person. But most importantly, throughout this presentation is to consider, you know, your child better than anyone. I know they've changed a lot. Those teen years, they come, sometimes it feels like they go in their room and come out a completely different person. But in terms of the behaviors I'm talking about, please consider that you know what's normal for your child. So when we're talking about changes in behavior, we can't just make a broad statement for all teens, but trust your instincts on that. You know when something's up, but I'll try to get as specific as I can. So if you're talking about personality and attitude changes, which is so fun with teens, if you look at this stuff, it seems like, well, that's every teen in America. But remember, we're talking about some extreme kind of sudden changes, nothing gradual. So behavior that's out of character and kind of consistently out of character, not just, you know, feeling off one day or maybe hormones are raging one day. A kind of sudden change in friends, maybe friends that they've been friends with for years, just really suddenly they've cut off from and they kind of are hanging out in a new group that you're not too sure about. Really extreme personality, and especially the attitude of, you know, I don't care, no big deal. And again, extremely erratic behavior. Like you think of like a roller coaster, you know, not a gradual drive up, you know, through the through Lake Tahoe, but more, you know, sharp up and downs. And just more hostile, especially if you're asking them about things about where they've been or what's going on, and really just seems uninterested in things that they used to be interested in. Now, interests change, just like, you know, my interests change sometimes, but we're talking about uninterested, but then not interested in anything else, not substituting, you know, you used to really like skateboards and now you're really into BMXing. That's okay. But if you used to really like to go out and skateboard and now you're spending every day in your room, you just don't care about it. That's kind of more what we're talking about. Behavior changes, this is things that they're actually doing. If you're noticing money missing, I know I'm kind of absent-minded, and my team knows that she can go in and get $5 out of my wallet for lunch. But we're talking about kind of major, if you're noticing things, especially kids are really good about using digital currency. So you do want to keep an eye on like your Venmo accounts and things like that to make sure that there's not things going and coming that you don't know what's going on there. Especially, Jacob mentioned, thank you again, Jacob, for your wonderful sharing today. If you notice that they seem to be selling off a lot of their stuff, that's even like game systems and things that are kind of worth money. And even around your house, if you're noticing all of a sudden, hey, where's that camera that, things like that kind of they could trade in for money. If you catch them lying a lot, again, I know every teen, but if it's more of a secrecy lying, like they're not honest about who they're talking to or where they're going, they're locking their door a lot more frequently than they used to. If their schedule changes, meaning like, they used to kind of like to sleep until maybe 10 and they were up till around midnight or 1. And then all of a sudden they're sleeping until 1 or 2 in the afternoon and they're up till 4 or 5 in the morning. Those are kind of what we're talking about. A dramatic change in appearance, maybe especially hygiene isn't as well. And out of place clothing means basically they're not dressed for kind of whatever the weather, the environment they're in. They're dressed really warm, on a hot day, or they're just short sleeves and shirt, on a really cold day, because drug use, and especially when you're going through withdrawals, that can really mess with your brain's ability to regulate your temperature. And they also might be trying to cover up, especially if they have gone to needle use, they might be trying to cover up signs of that. Physical evidence, if you notice discoloration or burns on fingers, that can be sometimes from pipe use. Like Bob mentioned, sometimes burns on the mouth can happen. Of course, track marks or sores that look like they're not healing very well or just look, kind of out of place. Really bloodshot eyes. We're not talking like a little bit of, Monday morning redness, like really bloodshot eyes. And drug paraphernalia. I will tell you, it's getting trickier and trickier to know as an adult, what is drug paraphernalia? There's so much stuff out there that makes it so easy for our young people to use in secret. I just did a hidden in plain sight presentation for Twin River School District last week and kind of demonstrated some of those items, which I'd be happy to do with anybody that's here. Please feel free to contact me. I can do that for your group or anybody that wants to, but it's quite amazing just on Amazon, the things that you can get to kind of cover up that drug use. Physical evidence that you might just notice looking around, and a lot of items that are used to cover odor. Why is there 5 empty cans of Lysol in my son's room? Or, my son, hasn't cared about candles as well. Why is there 10 candles in here? Things like that. If they're kind of hiding when you walk in the room, they put their phone down or, slant every single time. It's something to be concerned about. And again, I want to reiterate, you kind of know your kid and when your brain goes, that was weird. He doesn't usually do that, or she doesn't, or they don't do that. Trust yourself on that a little bit. And it could be other things, but especially if you're seeing some of this stuff, you're seeing this behavior in conjunction with other behaviors, if they kind of start stacking up, that's something to kind of take notice of. But drug nicknames is something to try to keep yourself aware of. It can be really tough. All of these little things that you see down here, Zerp, Tabs, Ice, Orange Tesla, those are all drug names and talking about drugs. Like Loud, if you said, hey, I love Loud, or I'm looking for some Loud, that means you want some really high potent marijuana, for instance. It's so hard to keep up with that. I did put a really good resource there that, again, I'll send this to Lindsay if you guys want to use it, but you really can, use Google or whatever source you use for that. Look those up. If you see stuff like, why is he talking Orange Tesla? That's weird. And like you see, we all know about the 420, for instance, when it comes to marijuana. Oil is the new 420 because if you flip, 710, is the new 420 because if you flip 710, it says oil, which they're talking about the high potent marijuana, like high contact. So that's just an example of how things kind of change. And again, I'd be happy to come back and talk about drug slang if that helps. Any of this stuff I can do. Now, in terms of drug seeking behavior, meaning that this is something that a lot of times people who are using drugs are kind of addicted to that, some of the things they do. If they're asking, especially if you're at the dentist or the doctor with your teen, and they're asking for specific drugs by name, they seem to be requesting higher doses, excuse me. They're claiming that they're allergic, or no, that drug didn't really work. I really kind of want to go for the oxycodone, that worked better. If they're claiming that they lost or somebody stole their prescription, I had it in my backpack and they stole it, if you're kind of noticing that more and more. And when you're at the physician, especially with them, you notice that they're concerned about that prescription. They're kind of wanting to get to that, tell me what you're going to prescribe me, more than finding out maybe what's the diagnosis is or what some of their treatments are. There's some very specific signs and symptoms of opioid abuse. I don't have a ton of time to go through them all, but again, they're here and I'll send that to Lindsay. But specific to opioid abuse, a lot of confusion and disorientation, slurred speech, decreased perception of pain is really high because opioids can kind of that's what they do, is they help us not experience pain. So if you notice, maybe they just grab a really hot cup or, really warm bowl of soup and don't seem to notice. Drowsiness is a big one, kind of their head nods. They seem to be sleeping a lot more and kind of just really breathing slowly. Some severe weight loss, their eating habits change. If their constipation is another one, because opioids and really all prescribed pain relievers can really kind of dry you out. They really dehydrate you. So that's something that you might be noticing. A decreased, again, perception of pain, any kind of muscle movement or total loss if your blood pressure goes down really low, a body temperature below 95, or a heart rate under 60 beats. That's something, if any of that stuff's going on, I personally would recommend, I'm not a medical professional at all, but I would recommend really seeking medical help if any of that stuff's going on. Another thing with appearance is the pupils are constricted, especially if you shine a light or they're outside in the bright sun and they have really tiny pupils. The coordination, itching and scratching is kind of a result of, being like opioid withdrawals a little bit. They tend to itch, especially if there doesn't seem to be, mosquito bite or any reason they're itching. And lots of sweat. Sweating is one of the biggest kind of soonest withdrawal symptoms. And again, emotional, severe mood swings, feeling really euphoric and then feeling really upset, poor decision-making, and really kind of abandoning responsibilities. Maybe they were a really good big brother or sister or a really good friend that used to watch out for things or take care of the dog. They walk the dog every single day and all of a sudden they don't care about that just overnight. Here's a little bit just to let people know in terms of if somebody is going through opioid withdrawals, it happens pretty quick. That's why these things can, 6 to 12 hours, you can start feeling withdrawals. That's, really soon for it, depending on the opioid that you're using. And then 30 hours for longer. And then 72 hours seems to be kind of the time when a lot of the symptoms peak in terms of vomiting, stomach cramps, things like that, drug cravings. And then if you go past that, in terms of a week or 2 weeks to a month, these are some of the physical symptoms kind of start to lessen after about a week, and it's much more psychological about week 2. And this can continue for a lot longer than a month, but this is just kind of a breakdown to let you see, especially it's a good idea to encourage your child to, if they are experiencing depression, anxiety, any of that stuff, if they can talk to someone, if they don't feel comfortable about talking to you, but if they have been using something and they're not using anymore, that could be the reason. So you could sometimes avoid needing to put them on depression or anxiety meds if you kind of figure out what their history is with that, and especially offering them the right to be honest with the physician about that without you knowing as the parent. That's up to you, but that's something I know some parents have done. There are home testing kits out there because some parents tell me, how do I know 100%? I really think so, but I'm not sure. Unfortunately, this is kind of one of the main ways, but fortunately or not, depending on how you look at it, these are available just about anywhere. Walmart, Target, Amazon, you can get a lot of these drug testing kits, and they do test for opioids. Another one that we've just become aware of called Verifique. They just opened it up. They just started doing this in October, but they're unique in that you don't have to necessarily test urine or crush the pill to notice. It's basically like a pen that you rub on the object, the pill, or they're doing these gummies here. And then there's a strip that you rub the pen on. And depending on if it turns color, it'll tell you if there's THC is one of the testing kits, or fentanyl. That's the two that they have. They have THC and fentanyl testing. So I don't want to testify about the validity of this stuff because, again, it's new, but it is something that's out there. I did want to just say this just came across my desk and I wanted to make sure and share it with you all today. A lot of parents ask me, well, where are they getting prescriptions? I thought doctors were up on this. What's going on? Well, there was a study in a WebMD that basically they combined a bunch of different surveys on this and found out that 60% of emergency visits with dental disorders ended up with the opioid prescription. And these are for young people. These are for teens and for young adults. Among young adults, the drugs that were prescribed about 38% of emergency visits for lower back pain. Because again, that's something that's hard to, you can't really tell with an x-ray. And they're much more likely to get prescriptions in the emergency room compared to an office visit. So it seems like emergency rooms are the places, especially if your kid's going to go to the ER. Most parents will go anyway, but you definitely, I would suggest having an adult there with them. And one of the things that we do have on the Omni website is a little postcard that we made, the Sacramento County Coalition for Youth developed. And it basically has 10 questions to ask if you're being prescribed an opioid. It's meant for parents and teens. So you can go on and get that, or you can go to the SCCY website and get that, just to kind of hand out to parents so that they have that with them. And for teens, most often it was either a dental problem, a collarbone, or a broken ankle were the reasons they got opioids. And for young adults, it was dental pain or lower back pain and neck sprains. And just a heads up too, I always like to tell adults that it's not kind of, hey kid, come here, kind of drug dealer where they're getting the stuff. A lot of the times, as Jacob shared, it's from friends, it's from people they know. And it's usually from somebody's home that a lot of the prescription drugs are being gotten. So that's why we suggest, if you do have opioids in your house, especially if you have young or vulnerable people, that you purchase some kind of, there's a pill lock that could go for individual bottles, but there's also just cases that you can buy to lock things up. You know, there's gun safes out there. There's all kinds of ways that you can lock things up, but we strongly recommend doing that for opioids and especially stimulants and things. And again, I can come back and talk about this, but at prevention, we really encourage talking early and talking often. We tell parents, educate yourself, try to find as many positive influences versus negative, find healthy opportunities for challenge, because that's what kids are looking for. And the biggest thing, a lot of surveys or studies are coming out now saying that the biggest thing that seems to help young people avoid drug use is practicing and learning skills to resist peer pressure. That seems to be working really well. So here's some really good resources that I like. Alternatives to opioid pain. There's a really good opioid toolkit for parents, how to protect kids from buying meds online, because that's another one. I could come back and talk about that too, because Instagram, especially recently, was just busted for that. They had an undercover operation that basically figured out, they pretended they were 12 to 17-year-olds, and it took about 20 seconds before a drug dealer reached out to that person offering them opioids and basically whatever they wanted. So I can come back and show evidence of that. But there's an example of that 12 questions, a little postcard that I talked about earlier that you can, again, get off of our website or the SCCY. Here's some other warning signs and prevention tips and resources for young people that are there as well. And thank you for having me. There's mine again, and we'd be happy to come and do any kind of presentation that, you know, would be helpful. Thank you.
Shari, you're amazing. We definitely should have given you more time, especially looking through your slides. So we'll definitely have to have you back so you can have a bit more time to go through this. For those of you that heard earlier, Sean Vassar from the U.S. Attorney's Office talked about that we are having a summit for an opioid summit for educators. And Shari will actually be one of the speakers at that, going over a lot of these warning signs for educators to look out for.